My name is Augustina, and today we'll be asking the question, should you spay or neuter your dog? First, I'll go into a little introduction, and we'll start off with some history. So did you know that in the 1970s, spaying and neutering your dog, wasn't as commonplace as it is today? The reason why it became so popular was because of overpopulation. As shelters filled up with more and more dogs had to be euthanized. So as a way to prevent the overpopulation, spaying and neutering became very popular. In addition to that was some benefits, like reductions in cancers and aggressive behaviors. By removing the gonads, cancers related to the reproductive system, such as testicular cancer, ovarian cancer, and uterine cancers were decreased, and aggressive behaviors were decreased as well. All of this was seen as a way to lengthen the life of your dog. So only positives, and who wouldn't want to spend more time with their pooch? However, what if I were to tell you that sterilization could cause more health problems for your dog than benefits? Before going further, I wanted to give a little bit of background on myself. I have 2 dogs, and when it came time to decide to spay them or not, I just went back to thinking about how I approached things in my university days. We were taught how to critically think, look at both sides of an argument, and weigh out the situation to make the best educated choice. I applied this knowledge of critical thinking when it came time to decide this for my dogs. Through my research, I found that this choice of spaying or neutering your pet dog isn't as black and white as it's usually presented. And through this presentation, I aim to clarify some of the pros and cons of spaying or neutering your dog. So let's go further. Recent studies have revealed some interesting information, and today I'll be talking about 3 main concerns related to spaying and neutering your pet. On the top, over there with the pug, you'll see is obesity. The one below it is a picture of a canine skeleton, and that will be orthopedic issues or bones issues. And on the bottom picture is a picture of estrogen, which is a hormone. So my 3 concerns are obesity, orthopedic issues, and hormones. First is obesity. So as we all know, having a healthy weight is important to having a long and healthy life. Obesity can increase the likelihood of other comorbidities such as diabetes, renal issues, cardiovascular issues, and even some cancers. My second point up here is about satiation and digestion. A study looking at the effects of diet and body weight of adult females after spaying showed the direct relationship between estrogen, a hormone produced in the ovaries, and food intake and digestion. Without the presence of estrogen, the spayed dogs were found to have to eat more food in order to feel full, to feel satiated, compared to the dogs that weren't spayed. This link showed that once the dogs underwent surgery, they were soon predisposed to becoming obese. So this study overall demonstrated that dogs that were operated required more food than intact dogs. My last point here is about diet adjustments. So alternatively, after looking at the study, an owner or a caretaker of the dog could decide on decreasing the food available to the dog so they don't have this predisposition to becoming overweight, or also provide a high fiber diet. In this case, the high fiber diet would limit the amount of fat and protein digested from the food, so it would minimize the risk of obesity. Next is the topic of orthopedic injuries. A study done on golden retrievers found that spayed or neutered dogs had a 25 to 50% increased chance of developing hip dysplasia or CCL tears. Additionally, this study found that dogs operated earlier in life had more issues with their bones because of their growth plates not being completely fused. Sex hormones, just like in obesity, have a lot to do with orthopedic injuries. They have a direct role in the fusing of these growth plates. And by taking away the gonads, you take away these sex hormones, and then the closure of the growth plates isn't as strong or complete. My last point here just mentions that breed and age are factors, and that issues with bones, orthopedic injuries, stuff like that, can be more complex than just the involvement of the gonads. It has to do with breeds. Some breeds are more predispositioned to certain orthopedic injuries, as well as the timing of the spay or neuter can have a big impact on whether it's a severe injury or not. The final concern is about hormones. So the source of sex hormones comes from the testicles and ovaries. That's where they are produced and where they function in the reproductive system. But they also function systemically in many other areas around the body. Studies have shown that their presence can increase and decrease certain diseases. So while specific reproductive cancers, for example, are decreased, so uterine, testicular, and ovarian cancers are decreased, the presence of neoplasias, lymphosarcomas, hemangiosarcomas, and mast cell tumors are increased. A study looking into the effects of androgens, like testosterone, in cardiovascular tissue has found that they play an important role in promoting cardiovascular health. Along with that, as mentioned before in the obesity part, estrogen plays a major role in controlling the appetite and digestion of food. So these are ways that the sex hormones play a bigger role around the body rather than just a reproductive one. And in conclusion, spaying and neutering should be considered as a case-by-case decision. You should always consider what is best for your pet. All in all, we must put our critical thinking hats on and consider the pros and cons of spaying and neutering with your veterinarian. Each dog is different, and what would benefit yours may not benefit your neighbors. We must consider our pet's well-being as our #1 priority. And remember, consult with your vet to do the best by your pet.